Hi, everybody. Welcome back to the Wholeness Campaign Podcast. This is Eric and Selena, and today we are going to go through the idea of being powerful in your healing process, particularly when it comes to dealing with different medical professionals who may or may not be speaking into your healing journey. And how do you kind of navigate healing when you have all of these voices, learning to listen to your own gut instinct and really make a powerful choice? We're going to unpack all of that today. Let's jump in. Yeah, so I want to kind of detail out what I think of when I think of being a powerful person. When we talk about being powerful, this is something this is language that's really familiar in the communities we've been a part of. Powerful doesn't really mean dominating, but it does mean being clear, being direct, being assertive, and it's basically meaning what you say and saying what you mean. I don't know if there's anything you want to add to that, but being powerful is all about kind of being the opposite of a victim. So, you're not being a victim. You're not having any kind of woe is me mentality. And you really are believing that change is within your grasp, like believing you are capable of change and believing that change is ultimately your responsibility. So it's radical ownership. It's taking full responsibility for your life, not believing that you're completely on your own to do everything by yourself, but it's this kind of radical responsibility, radical ownership of if I want a desired outcome, I am capable of kind of making that happen, in a sense. So not in this, yeah, I'll put a caveat that it's not in this gritting, stressful sense, but it's in this sense of I believe that I'm worth it and capable of it, and I'm going to make some clear, responsible choices to make that happen. I see a lot of people in this space, the space of healing, especially people dealing with chronic issues, feeling overwhelmed by their circumstances and then ultimately becoming a little bit powerless in their approach. I don't know. I guess we could kind of start there, but what do you think, Eric? Have you seen this play out, the idea of people being powerless and in their health journey? Where have you kind of seen that?
Well, I think what I think about when I think about what I think about when I think when I think about being powerful in this area, for me, I think that means like asking questions, doing research, like looking into it. It's like being like an active participant.
Yeah.
I think like growing up, I don't know, it's like weird, like growing up, the way that I engaged in health was you kind of just take the doctor's word for it and you're not really an active participant. You don't really do any research. There is a lot of trust there, and yeah, you're kind of just sitting passenger, right? So I think, I don't know, I have mixed feelings about it because I feel like there should be experts in fields.
Yeah.
There's experts in every field, and I actually want there to be experts
Right.
in the health field.
Yeah.
I'm not necessarily an expert in the health field.
Mm-hmm.
Um, I want to actually, so part of being powerful is doing your research on who can you really trust in the health field, hearing all different sides, because maybe you've just heard one side your whole life and that's all you know, right?
Yeah.
So you've just heard your whole life, this is bad, this is good, this is the way. But if you did some research, you might find out that there's other points of view.
Right.
There is other data. There are other doctors that are saying something completely different. So then you kind of have to decide really what you, once you know all the things or more of the things,
Mm-hmm.
you kind of have to decide where you land. So I think being powerful does have to do with knowing more,
Mm-hmm.
uh, putting yourself out there to actually ask questions and have a voice.
Right.
Having a voice, looking for options. A lot of times you get the diagnosis,
Yeah.
the result, and then the doctors just say, "Well, this is what you have to do," and you don't even
Right.
look, you don't even ask for, well, is there another option? Are there other ways?
Yeah.
Um, so I feel like being powerful is realizing like you have choices, you have options.
You
Um,
get to fire the medical professional whenever you want.
ultimately, you get to choose.
Yeah.
So if you want to choose that route, you can. But I think we don't even realize that we are not like, I think subconsciously maybe we do feel like we are powerless. And I think it also gets tricky because there's a lot of emotion tied to health. So
Mm-hmm.
if you get a hard like diagnosis, like you have something, a disease or some condition that feels really scary, I think that emotion drives us. It puts us in a place where we can't think as clearly.
Right.
So I think then that just plays into it as well.
Right.
Of just like, I don't know if the doctors are doing it on purpose. Maybe some of them are, but it's almost like you're in a very vulnerable place, and then and they're like, you have to do this, and
Right.
then you just do it because you're scared. And they say scary language like, if you don't do this, X, Y, and Z will happen.
Right. Right.
So you're kind of in this vulnerable place. There's a lot of emotion and fear, and then they're telling you you have to do this or else you're going to have this really horrible consequence. So most people just do it, right? Um,
Mm-hmm.
but you might not be getting the full truth or the full picture,
Right.
right? So it's hard. It's hard. It's been a battle for me growing up in like having a lot of trust in the traditional medical system, feeling like there is still a place for it, but like redefining what that place is.
Right.
And then it's becoming more mainstream where a lot of these things that we've been told, just realizing like they're not the full truth.
Right.
Like the things that we've been told that are good for us. Like, I remember growing up and like cereal almost being marketed like it was good for you because it was whole grain and it's good at lowering heart disease and stuff like that. But then
Right.
it was marketed like cereal is good for you because it helps with your like Cheerios. It helps with your heart health.
Which is like
Remember, you know what I
the
mean?
biggest joke.
Yeah, so we believe these things unless we do the research, but if you now it's kind of like obvious and more common knowledge that that isn't really the thing that lowers heart disease. There's so many like harmful parts of cereal that it's like they're just pointing out this one thing, but they're not acknowledging like how it's processed food, like sugar that's in there, like all the
Yeah.
just other stuff, the harmful things that actually are harmful to your body and your heart. So it's like this, I think you need to like question things and go on the journey of like not just being so gullible, you know,
No, it's
and just
true.
being
It's
so, and
true.
it can feel scary because you, especially if that is just all you've ever known.
Right.
It's like, it can just feel like when you question a doctor, especially because I think, and I'm just going to land here and then you can jump in, but
Yeah.
I feel like a lot of the ways the system is like, it almost feels like you, like the way some doctors talk to you, it's like they talk down to you.
Yeah.
And they almost talk from a place of like I was in doctor's office recently. I had to do a physical because I needed to go get a physical in order to do something. And he mentions that I wasn't up to date on my vaccines. And he doesn't, it's so, I think in a lot of them, I think they're just so used to people just doing whatever they say that I don't even know if they fully realize they're doing it. But the language is like, oh yeah, and yeah, we need to get you up to date on your vaccine. So we're gonna go and do that today. Da 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 da. Like almost talking like it didn't even ask me like, hey, do you want these? This
The informed consent
it'd
is
be
not
one
there.
thing to mention like, hey, I see that you're not up to date on these. Are you interested in getting these? It was like just going ahead like, okay, yeah, along
I
with the
love that
physical,
we're going to.
yeah. And I had to say to him, hey, yeah, I don't want to do that right now. Like, I don't want to get those vaccines. And
Yeah.
he was like, well, why not? You know, like he's like, like it was like you just saw a ghost. Like it was
Yeah.
just that me just saying no, I'm okay on that was as like he never gets that response. And I was just like, well, like I'm going on my. I don't know if I trust them. I'm kind of I'm just being honest, like I'm kind of going on my own journey. Like I don't
Yeah.
know if I really want to do that. Like I'm doing my own research. I'm trying to
Yeah.
figure out like if this is the best thing for me. And I just think the dynamic hasn't been like that, so it's new and different
Yeah.
when you start to act like that. And I feel like that is it should be a partnership with you and your physician, your doctor, where they're like giving their advice and input, but you also get to question and ask questions.
Right. Well, I've seen it. I will just jump into this whole side of things where part of being powerful is recognizing language when someone tries to treat you as if you are powerless. So language, like I've seen this all over the internet. Like my doctor let me do this. Let you?
Yeah.
What? How did they get into a place of such authority that you have to ask them permission
Yeah.
to do something for your own body? Like there's just a complete assumption that you do whatever they say, you're at their mercy. Oh, if they say no, the answer is no. Like you're a child.
Yeah.
Like you're a child being controlled. And so I think that's another dynamic here is there's really controlling powers at B in the health space. There's
Yeah.
really controlling people. And there's systems that act controlling because um, we've allowed them to operate in that control. We've never confronted it. And so there's like a whole system in place that's acts controlling and treats us as if we're powerless because we're this powerless victim that just needs their help and
I think
we're dependent on
there's like a
them.
security complex, but
Yeah,
I think in a lot of ways we have contributed to it. It's like both. It's
it
like
is both.
there are controlling people there that they feed on that. Like they're the experts, they know more.
Right.
But that we've kind of played into it too. So there is this like there's this like subconscious belief of like, yeah, they're superior
Right.
to us. And it's
It's a
not really a
culture.
partnership. It's like,
Yeah.
yeah,
Yeah, well it's a culture um that treats medical situations, as if there's a victim and a hero,
yeah, then they're the
and
hero.
they're the hero.
Yeah.
And so when you're the hero, how could you ever say no? Like, how could the victim ever say no to this heroic act that the hero's coming in and rescuing you from your pain?
Yeah.
And that's why I think it's so important to get to this place of feeling and being powerful in your health, because as long as you're a victim in your health, you will continue to treat people, systems, the medical system, as the hero. And as long as they're the hero in your story, you are not going to fully be able to make decisions with a clear mind. Because if they're the hero, then there's bias. There's bias, like, well, I trust them fully, and so then their opinion is going to take a much larger spot in your mind than maybe it should have.
Yeah.
Because the truth is, you don't know this person. You actually don't really know how they were educated. You actually haven't done the research yourself. And so putting them in the hero spot, which really started with you putting yourself in the victim spot, can be very detrimental to your health because you're not then doing the research. You're not questioning things. And whenever people don't question things, they have the potential to end up in these cycles of misinformation and doing things that end up contradicting the health of themselves and their own internal conscience, because you actually want to, like, your body actually subconsciously wants you to feel powerful. You actually want, the inner you has a core need to feel like they are capable of making a decision and respected in that decision. And you kind of, like, oftentimes people are just bypassing that, which then isn't getting that core need met. So then there's this emotional component of this health crisis you may be in, where you're not just actually giving your power away for the practicals, you're giving your emotional internal world away. And that can be part of what makes medical decisions so emotionally taxing.
Yeah.
Yeah. I wanted to kind of bring that into the light because I think it's just a really, really common problem that I'm seeing across everything. I'm seeing it in my own life. I'm seeing it. I had this issue with a dentist recently, actually, because I personally don't do checkups, like traditional checkups for my health, but I do for dental things. And I found this dentist that I trust. I really liked their values. And so I really trusted their opinion. But then the problem with, like, putting all of my eggs in this basket was it actually did cloud my vision. And it took me a while to actually process that, like, I actually still don't feel right about doing this thing that, even though it might actually, like, broadly speaking, be the right thing to do, I didn't feel right about it. And it took so much grappling to kind of come to the place of, like, okay, I'm actually just going to honor that feeling inside of me, even though it doesn't logically make sense right now, because I'm going to practice this idea of, like, doing things out of peace and feeling powerful in it. But I had put them on this pedestal in my mind, and I had put my eggs in this basket, and I had become this, like, probably subconsciously, I had made them out to be the hero and felt like I need them to be okay. Like, for me to be okay, I need them to approve of what I'm doing and to do things the exact way that they want me to do them. And it's obviously stuff that, like, matters.
Yeah.
And yeah, I actually ended up making the decision. I've never done this with a dentist before, but really making the decision. Usually, if I don't trust an opinion, or if I feel like dissonance inside, I will just find a different dentist. That's what I had been doing. I never would be like, stop and just say no. But at this point now, I've done all the research. Our area, this actually is the best dentist. Like, this is the best, most holistic minded approach, like, dentist place that there is in this area. There's actually no more research to be found on better dentists. At this point, they are just recommending something that probably is the better thing, but right now it just doesn't feel right to do that. Like, I want to wait. There's a few reasons why I want to wait, but what it comes down to is I just know these situations can be more complex than what is at the surface, and I feel more comfortable waiting it out than and they even know that it's complex, but they still are recommending a certain protocol.
Yeah.
Maybe partially because they kind of have to recommend certain things, broadly speaking.
Yeah.
Typically, this is what I would actually agree with them, but I needed to feel powerful in the decision, and so
Yeah.
I'm like, I'm gonna wait. I'm gonna question. I'm gonna think about this a little bit longer. I'm gonna give it a year. I'm gonna give it a year.
Yeah.
And if my tooth implodes and cracks, and I need to get it completely ripped out of me, so be it, because there's a part of me that I'm like, I need to get to this place of trusting the inner intuition.
Yeah.
Not because I'm scared, but because I need to get to a place where I feel safe in myself and I'm not subject to anybody as the hero. Like, I'm the hero in my story. I'm the powerful one.
Mm.
I'm not the victim that is at the mercy of everybody's decision. Like, I get to be a part of this decision.
Yeah, you get to be. I think that's the most empowering. Yeah, I think it's super important that you feel like you're a part of the decision.
Yeah, yeah,
Like no matter what you choose, no matter what you decide. I don't know. You said something the other day too that I thought like, oh, that'd be like when I was having that interaction with that doctor, and you said something like, oh, he's not even in the posture. A lot of these doctors aren't in the posture of like serving you.
yeah,
Like, and I just think that would be really awesome if we ever got to a point where, because I think no matter what you do for work, no matter what your job is, whether you're a doctor, a lawyer, in business, ministry, I feel like the healthiest posture for any person is to be like, hey, I'm serving the one that's in front of me.
right.
Like, not coming like you're better than them.
Mm-hmm.
Even if you do know more than them, even if you are more of an expert than them,
Yeah,
it's like, I'm not going to use that to bully them. Like, I'm actually going to
yeah,
serve them. And I think that's another tricky dynamic here is in a lot of ways, like, I don't like the word should, but it's like that should be their posture.
yeah,
Or it'd be very helpful and loving, beneficial if that was their posture. But
mm-hmm.
unfortunately, it's not. And I think a lot of people get bullied into things that they're not ready for, they haven't chosen into. And um, yeah, and you might be like, you might feel that. And you might need to practice slowly having a voice with little things.
Yeah. That's something that you did this week, and that was really cool.
Yeah, I did. And yeah, I practiced that, and he recommended, the doctor I met with recommended something else, that I should be taking this other medication. And I was like, well, I've done my research, like, in this area, and it's not just random Joe schmoes supporting this other viewpoint. It's like
Yeah,
other doctors,
right,
um, literature, like that is supporting a whole other approach to this issue.
right,
What?
right,
Yeah, and
right.
I was telling him that, and yeah, I mean, ultimately he was like, okay, like he actually did, like,
No, he actually respected
he
it.
respected it.
I wasn't expecting
Yeah,
that
he
based off
definitely,
the verbiage he
yeah.
used, but
But I think the other important part of this is like, as you learn to have a voice, like, keep your respect on, like, keep your love on. I don't think it's not going to be beneficial for you to be like, F you, F this, and like, be bringing disrespect back to them,
right.
even if they are
That's a good
operating
point.
in it. Like, being powerful is not you being a bully. It's you being respectful, being honest, um, keeping your love on, and just, I even said to him, I was just like, hey, like, I respect your input. Like, I'm sure you've done your research. Like, it's almost like I'm not thinking he's the bad guy either.
Or there's no
there's no bad guy here. Like,
yeah, that's really good.
Just because I disagree with their approach, I'm trying to give him the benefit of the doubt. Like, I'm assuming, I'm giving him the benefit of the doubt, like, that he really believes what he believes. And he's not, he is trying to help me.
Yeah.
He's trying to help me the best that he knows how to. And I'm like, hey, thank you for giving your input. I appreciate it. I can tell that you care. Yeah. All that kind of stuff. But right now, like, this is the approach that I want to take.
I think when you
and people
get that,
respond most of the time, respond well to that. Yeah. And we adjusted, and we took a different approach.
Well, and I feel like sometimes people leave these conversations feeling really slimed. I don't know if you know what that means by that, but it's like feeling very icky, because part of it is because when you engage in the disrespect back, that's not being powerful.
No.
And so you end up now you feel victimized, but you feel like you just did the dance. You just did exactly what they were doing to you.
Yeah.
Like, disrespect. You sowed disrespect, kind of like reaping and sowing, the whole idea of like whatever you put out there, it kind of comes back to you. Like, you sowing disrespect, you end up reaping this feeling of, it's a false power.
You just don't,
power. It's a false power. It's like it's not actual power.
No.
It's not self-control. It's not going to make you feel more empowered in your approach. It's probably the battle happened because you actually are insecure in your approach, and you don't really know how to be confident, but also respectful. And you just see this over all of social media. Like, I do extreme posts sometimes, but that's not really an invitation to just like bash people.
No.
Really, what we're trying to do here is come to a place of like deep understanding that you have a different opinion than me. That doesn't give you the right to talk to me this way.
Yeah.
I'm going to be powerful and show up and have a voice here.
Yeah.
And because of the way you're talking to me, I need to assess what I believe.
Yeah.
And I'm going to bring that to this conversation, or I'm going to choose not to have a conversation with you anymore. Yeah. And you get to be completely free and not go back to that provider. Yeah. But instead of like going back to them year after year after year and complaining about the doctor, it's like, okay, what does it mean here for me to have a voice, be powerful, make decisions for myself, and be respectful?
Yeah.
All of that is what it means to take your health into your own control, into your own power. And
because it just means, honestly, it's like you're showing up wholeheartedly.
Yeah.
Like, if you show up, you have a voice, you ask questions, you're respectful, all that, like, you're showing up as your whole self.
Yeah.
And
right.
I think you walk away feeling like you honored yourself.
Right.
Like,
it is a form of self-honor. However you treat other people is actually, it's a kind of a reflection of how you
you just felt like you walk away feeling like, all right, like that, that was a brave thing. That was,
I love that.
I was a part of that. I was a participant.
I was an active participant. Mm-hmm. I honored myself. I didn't lose myself in that conversation.
Yeah, and then no matter what you choose, whether it works out or not, at least you know you're not a victim to it.
Yeah.
And you did what you could do.
Right.
So whatever you choose, like if you choose to go with what they recommend or not, and whether that works out or not, there's no one to blame.
Yeah.
There's no one to blame. And that's another part of being powerful, is like you're not giving in to the blame game.
Yeah.
So we're not talking about, like, we don't want to demonize, at least we don't want to demonize, we're not demonizing the medical system.
Yeah.
We're not, I said this in another video too, like, yeah, it's not just blaming them, it's also taking ownership of what we've created.
There's
And like,
nothing we can do to. That's the thing is, I hear this conversation all the time because maybe there is some kind of demon out there in the medical system. Whatever, people are so obsessed with calling it out,
yeah,
and it's like, at the end of the day, that's going to do nothing because you can't control them.
no,
You literally have no control
yeah,
over someone else's choices.
no,
So what are you going to
yeah,
do? How are you going to show up in that system
yeah.
in a powerful way?
And that's why, yeah, blaming. I don't really. I mean, yeah, we do.
Blame makes you
We'll
the
make
victim.
wait. We'll make videos sometimes that seem a little extreme, but they're not really rooted in blame. It's meant to like expose something.
Yeah.
You know what I mean? But our heart is actually not to operate in blame, not to demonize. There's not a bad guy. There's human beings that have histories, they have stories. There's a reason why they believe what they believe. But we're also talking about like, hey, as the
Counter.
as the patient, as the person that's vulnerable, like this is how you can show up powerfully.
Right.
You can show up by asking questions, by doing research, by being respectful, by not blaming, by
ask for another recommendation.
Yeah.
Ask for
Yeah.
another referral. Like
Yeah.
like do some digging online. Maybe you find somebody different to
Yeah.
represent you. Blame makes you the victim.
Yeah. It's not going to be helpful. Like that's not the answer either. Is just to be like, well, they're all bad, so I'm going to like, I don't know, you know what I mean? Like
Yeah.
just not trust. I don't know. Like I don't know if that's the ultimate answer either.
Well, I
It's
see.
just-
Well, then there's this other side where it can be very dysregulating to your nervous system and can actually probably perpetuate sickness
Yeah.
for people to be in this state of feeling like I can't trust people or like. But I think deep down, it's like you have to go on the journey of like learning how to say no, learning how to have boundaries,
Yeah.
because what like the abuse that you may be feeling from
Yeah.
this system might partially be
Yeah.
that you put yourself in the circumstances to receive it
Yeah.
and you never had a voice
Yeah.
to combat it yourself.
And then you're blaming them
And
for
then
what happened, so they're the bad guy, but you
Right.
kind of chose it. And it's like both. It's like
They shouldn't be doing that.
Yeah,
Yes, we know that. We know that they shouldn't be acting like they're the hero and you're the victim. We know that they should be offering different alternative solutions. We know that the solutions they're providing is based off data that's outdated. We know this stuff. I agree with it. We know that I'm not going to view them as God. We know that ultimately being a part of the system is going to give you a certain result. We know that.
Yeah.
But
you've kind of played into that.
Yeah.
So it's both.
There's this other side where for you to start feeling powerful in your health journey, for you to start feeling like you're in charge, you're steering the boat, you may need to take some ownership for the part you played in the dynamic of the hero and the victim.
Yeah. Because you agreed. You said
yes.
disclosure.
I know.
No one made you sign the thing.
Yeah.
Even like
it's convicting. Yeah.
Even though I know there's certain tactics that are used, and it's hard. So that's valid. That can be validated.
And you may never have learned this growing up.
Yeah. But I think it's really important to realize, like even going in when I got some blood work done, I knew that the doctor was going to recommend something that I didn't want to take that medication. I wanted to take a different route, but I knew that I knew that it was going to be fueled by, if you don't do this, like some fear tactics. But honestly, I kind of told myself, like, you know what, like they might be perceived as fear tactics to me, but he genuinely might feel afraid.
Yeah.
Because he doesn't maybe know what I know.
Right.
Or look at it the same way I do.
Totally.
So I get it. All that's there. The emotions are there. The fear is there. I mean, came with a certain level of intensity and like.
And should you speak to somebody like that?
Yeah.
No,
that wasn't.
but
I still, going into it, I knew you have to think realistically of what you're stepping into, and you kind of have to have your, what we call like a shield of faith, or like have a healthy guard or boundary up a little bit. So you're not making decisions just emotionally.
Yeah, you're not coming with your heart on the table.
Not just emotionally, right? So you're hearing what they have to say, and then ultimately you're being powerful by making, so you're saying, hey, I hear what you're saying. I think for now I'm going to choose this.
Yeah.
Right? So what does that look like? If you're listening to this, what does it look like for, maybe you have an appointment or something coming up, to step into it powerfully, to keep your love on, to stay respectful, to maybe do a little research before you make the decision, to not pin him as the bad guy. So you're not going in. I didn't combat him. I wasn't arguing with him. I wasn't.
You don't need to argue when
you don't need to
powerful.
argue. Yeah, I'm not arguing. I actually said, like, I understand, like, where you're coming from.
Yeah.
But this is another side of this coin that I'm taking into consideration.
Yeah.
So this is the decision I want to make.
Right.
And he respected it.
And you don't.
And they might not all respect it. They might be like, you're making a mistake, da 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 da. And then you might have to set a boundary and say, hey, I'm going to have to end this conversation right now. Like,
because I'm not being. I don't feel.
You don't have to give them a reason. You could just say, hey, thank you for your input. I have to leave. I have something I need to attend to. Like, have a good day.
Yeah.
And just end the conversation. Like, you don't have to subject yourself
to any kind of abuse or
to that. You know what I mean?
Disrespect.
So, I don't know. What does it look like for you to practice being powerful? Like, I'm not perfect at this. Selena's not. No. That moment for me was a practice moment. I was really scared going into it. I had a lot of anxiety. That feeling of growing up and being like, and he was like blowing my phone up. And I was like, I knew what was coming my way. I just knew. And that little kid in me was like scared to have an adult voice. So that little kid who was feeling powerless, it was coming up, but you need to practice.
This is part of it.
Having the adult voice for that little kid that maybe never did.
I love that.
So it's going to take practice, guys. This doesn't happen overnight, but it needs to start, and it needs to be little practices in order for it to become who you are, and it'll become more natural. So, yeah.
I love that. Well, thank you guys for watching. We've been talking a lot about different topics around empathy and power, and what does it really look like to take ownership and step out of this victim role, partially because we've both put ourselves in that role before, and we are walking out of it. So if you're walking out of it too, let us know in the comments on YouTube what that has looked like for you. Like this video on YouTube, subscribe to my channel if you haven't already, and leave us a review if you're on a podcasting platform. We would love that. So we will see you in the next one.
See ya. Peace out.